Hello friends, today we are going to discuss some more important one-liners in pediatrics. To start with, which amino acid is known as nature's sleeping pill? Answer is tryptophan. It is because tryptophan is the precursor of serotonin, and as tryptophan is the precursor of niacin, it is also known as provitamin B3. Niacin is known as vitamin B3. Second, wheat lacks which amino acids? Answer is lysine and threonine. Generally, cereals lack lysine and pulses lack methionine. Next, from which day of life a IUGR baby should start gaining weight? Answer is, it is from day 2 itself. As we know, there is a physiological weight loss that do occur in term and preterm babies. But IUGR babies, they have already lost weight in utero. So there should not be any weight loss in a IUGR baby. They should start gaining weight by day 2 itself. Next, Wilson's disease occurs due to defect in which gene? Answer is ATP7B. To add something, the condition is autosomal recessive, chromosome affected is chromosome number 13, gene is ATP7B. There are various manifestations: hepatic, neurologic and hematological manifestation. Hepatic manifestation do occur early, first decade itself. The presentation wise, it may be a case of hepatitis, it can present even a case of fulminant hepatic failure. Your KF ring is present in 50% cases of hepatic manifestation of Wilson disease. But neurological manifestation may be tremor, dystonia, neuropsychiatric manifestation, and KF ring occurs around 95% cases of neurological Wilson's feature. In neurological manifestation, we are getting KF ring 95%, but in hepatic cases, we are getting KF ring in 50% of cases. And hematological abnormality, we are getting Coombs negative hemolytic anemia. Treatment wise, your penicillin challenge test and liver biopsy. Liver biopsy is the diagnostic test. Normally, we are getting less than 10 microgram of copper per gram dry liver tissue, but diagnostic is more than 100. Treatment wise, we have to remember penicillin, the drug of choice, other molecules which we are using, zinc, triindine and tetrathiomolybdate. Next, which hormone is responsible for milk secretion reflex? There are two terminologies. One is milk secretion reflex and another is milk ejection reflex. Then which hormone is responsible for milk secretion reflex? It is prolactin. Prolactin is produced from anterior pituitary. It is mostly secreted in night. And oxytocin is responsible for your milk ejection reflex. Oxytocin gets secreted from posterior pituitary. Sucking as well as thought, sight and sound of the baby. These are the factors responsible for secretion of oxytocin and secretion of milk. It is affected by the emotion of the mother. Next, sernat and sernat staging is used to classify which disease. It's a very simple question. The answer is HI. As you know, HI has been classified stage 1 and 2, stage 1, 2 and 3 as per sernat and sernat. Other staging responsible, other classification available for HI are Levin staging and another is Thompson scoring. Next, BCG catch-up vaccination can be given within what age as per NIS? As you know, BCG usually given at birth, but if somebody has missed that dose, then within what age BCG can be given as per NIS? Answer is 1 year. But if question is BCG can be given, the catch-up vaccination for BCG is up to what age BCG can be given as per IEP, then answer is 5 years. As per NIS, it is 1 year, but as per IEP, it is 5 years. To add something, hepatitis B total doses is 0, 1 month and 6 months. Suppose somebody has taken only one dose of hepatitis B some 5 years before, then how many doses to be given? Then only 2 doses, because total doses for hepatitis B is 3 doses only, 0, 1 and 6. Suppose somebody has given 1 at 5 years before even, then this dose which we are giving today is to be counted as the second dose, and after 6 months the third dose to be given. Then for IPV, similarly, the schedule is catch-up vaccination schedule is 0, 2 months and 6 months. For PCV is important. PCV, pneumococcal conjugate vaccine. Then it depends, catch-up vaccination depends when the baby is coming. Suppose the baby is coming within 6 months, then schedule is 3+1. 3+1 means 3 doses, 1 month apart and 1 booster at 15 months. Suppose the baby is coming between 6 months to 12 months, then schedule is 2+1. 2 doses, 1 month apart, 1 booster at 15 months. Suppose the baby is coming between 1 to 2 years, then schedule is 1+1. 1 after 8 weeks or 2 months, plus booster to be given. Suppose the baby is coming within 2 to 5 years. As you know, PCV is indicated up to 5 years. Suppose some baby is coming within between 2 to 5 years, then schedule is what we are giving. Either we are giving PCV 13 or we are giving PCV 10. So for PCV 10, 2 doses. For PCV 13, it is single dose is sufficient as a catch-up vaccination for PCV. Next question. Most common cause of AG in less than 5-year children. As you know, ARI and AG are the leading causes of death in under 5 children. The most common cause is AG is viral, and most common virus is rotavirus. Second question, the question can be, which is the second most common virus? The second most common is Norwalk virus. Then to add something, treatment is ORS and zinc. For viral diarrhea, no antibiotic, only ORS and zinc. Dose of zinc is 20 mg per day for 14 days. So if the baby age is 6 months to 5 years, suppose the baby is less than 6 months old, then dose is 10 mg per day for 14 days. The total duration has to be 14 days. Then another question, what are the indications of antibiotic in diarrhea? Indications are dysentery, cholera, and if your baby is a SAM child, severe acute malnutrition child, then we are allowed to use antibiotic. Otherwise, only ORS and zinc is sufficient. Next, name the syndrome. Here we can see low posterior hairline, your pedal edema, your dorsum of the hand edema, and your waving up neck. Its answer is very easy. It's Turner syndrome. Karyotyping wise, it is 45X0. The single X chromosome is maternal origin in 80% of cases. This we have to remember. Question may be asked, single X chromosome is maternal origin or paternal origin? It is maternal origin and 80% of cases. So the clinical picture wise, it is short stature, waving upper leg, low posterior hairline, broad chest, cubitus valgus deformity. These are the features. Associated congenital heart disease, most common is your bicuspid aortic valve, but clinically important is coarctation of aorta. Other important clinical feature, we can get horseshoe kidney and primary amenorrhea. Suppose an adolescent girl with primary amenorrhea, you are getting short stature, then Turner syndrome has to be ruled out. Next, PHACE syndrome. PHACE syndrome, P stands for what? This is a common question they ask. Answer is P stands for posterior fossa malformation. H stands for hemangioma. A, arterial anomaly. C, coarctation of aorta. E, eye abnormality. This is PHACE syndrome. Sometimes PHACE syndrome they ask. Here S stands for sternal clefting. To recap, to recollect what we have read, nature's sleeping pill amino acid is tryptophan. Wheat lacks amino acid, lysine and threonine. IUGR baby, there should not be any weight loss. They should start gaining weight by day 2. Wilson's disease, your gene responsible is TP7B, chromosome is 13 and autosomal recessive. Prolactin is responsible for milk secretion reflex and oxytocin is responsible for milk ejection reflex. Sernat and sernat staging is used for HIE and other scoring system, Thomson scoring, and another staging is your Levy staging that is used for HIE. Next, BCG vaccination can be given up to 1 year as per NIS and up to 5 years as per IAP. Most common cause of AG in children is rota. Second most common is Norwalk virus. Most common heart anomaly in Turner is bicuspid aortic valve, and clinically important is your coarctation of aorta. PHACE syndrome. P stands for push-to-push anomaly. Thank you. Please like, subscribe, and share this channel. Thank you.